Well, I think Mental Health Day is a good start. I think having just one day isn't enough, but it's a good reminder that we need to turn our attention towards that. And I think one of the biggest things is just talking about it. I mean, I don't know too many people on the face of the earth that haven't been touched by mental illness or mental wellness issues. So whether it's yourself or somebody in your family, let's just talk about it the same way we talk about a broken arm. That would be a good start.
Jody, what are some of the stigmas that you're aware of around mental health right now? The things that people really, have sort of negative connotations attached to them.
Yeah, well, I know definitely I'm working with youth. So we work with under 30s. So in young people in particular, there were some studies done, and it's still the number one factor that prevents young people from reaching out is the fear of being judged or the shame that's attached to it. I think that for a long time, mental health issues have been considered a weakness in character, which is unfortunate because we don't do the same to people who are suffering from epilepsy or diabetes. But when it comes to our mental health, it's easy to pass judgment because we see somebody's behavior maybe change. And so we are judging them based on that and not on the underlying issue. So for young people, it's the being judged. It's the being seen as weak or not able to sort out their own issues.
And again, how do we kind of bring this conversation forward to make young people more comfortable with the idea of talking about this?
Yeah, I think it's important for parents to share with their young people examples of their struggles. I think sometimes it's hard for young people to go to their parents and ask for help. And with such a confusing mental health care system, if you don't have somebody on your side when you're young to help you navigate that, whether it's a parent or, a peer that's well versed in it or a service like ours, you're going to need somebody who's got your back. They're open to the discussion, but they also will validate your concerns and not just dismiss them. I can't tell you how many young people I work with that have approached a parent and the parent has said, suck it up, buttercup, in one form or another. You're fine. Keep your chin up. Just get outside more. There's all these things that are said to people when they finally have the courage to speak up. So I think everybody just needs to validate each other because you don't have x-ray vision. You don't know what's going on inside somebody's head. And there's this misconception that if someone is smiling and functioning, they're fine. And that's not always the case. People who are struggling definitely can look like they're functioning great too. So listen and validate.
Validation is such an important thing these days. I mean, it's been, we're in an era now where terminology is being questioned. And one of the things that I have also has been a proponent of changing is using this terminology around mental health, of saying things like, you need to grow thicker skin, you're too sensitive, you worry too much, things like that I think people just aren't aware have such a negative connotation. They are so, I'm going to go as far as saying they're offensive, and they're quite derogatory to people that have mental health issues, because you are not validating what these people are feeling. You're pushing it off as something that is tied to their personality, which is such an offensive way of doing something.
For sure. And I mean, you don't know, maybe that was the one attempt that they were going to make in reaching out. And if you're a wall and not a door, you could have catastrophic effect on somebody's life by dismissing their concerns that way, because you don't know, maybe you were the one person they were comfortable with. And by minimizing it or dismissing it, yeah, you could be literally creating a barrier for someone getting the help they need. It's serious, very serious. You're right.
It's interesting that, this has been preceded by the National Coming Out Day, which is the two things are very much tied together in very similar ways. And one of the things about, National Coming Out Day is having the idea of having somebody safe to come out to, somebody that you feel safe coming out to. And I think that's the similar thing. You're just saying this too with mental health issues. You need to have somebody you feel safe talking to about these issues, right?
Yep. And I've never heard that comparison. And I think it's brilliant, James, because you are coming out essentially, because just like your sexuality or your, expression or your identity, it's internal, it's personal. And to share it with somebody and make yourself vulnerable is very similar to sharing what's going on inside your mind. So I think it is a coming out of sorts. And I like the way you put that. So yeah, having those allies or those people that we know will be caring to us when we finally admit that something is going on the inside. I think that's key.
So Jody, tell me how MiND-AID Muskoka is really changing the face of how mental health services are being offered to, especially to youth in this area.
Sure. Well, here in Muskoka, in the district, we do have a fair number of mental health services and resources. The tricky bit is not knowing which ones align with which issues. Mental health, just like physical health, requires specialists. I mean, we've got ear doctors, eye doctors, tooth doctors, bone doctors. In mental health, we have all different practitioners that have different roles, and some cost money and some are free. Some require a referral from a doctor, some don't. Some people don't have a doctor. So there's all these barriers that come up, and we just don't have the fluency in the mental health care system as a society. So our service, we don't supply therapy or clinical assessment. What we do is help you navigate that. We know the system really, really well. We know where the barriers are. We know where the difficulties are. We know where the gaps are, because Muskoka doesn't have the resources that a larger city has, but we can find the thing that fits whatever the struggle is with our clients, with our young people, with their parents, by hearing their story and pinpointing where is the struggle originating from. Is it a bunch of contributing factors that need several different services and resources, or is it maybe one event that happened, a situational thing that's caused trauma? So through conversation, we determine what's the root, possibly, and then we send them to the proper service or resource to get a diagnosis or get a referral or get therapy. And even when they encounter the barrier of funding, which is a big one, just like dentistry, mental health isn't always covered in every aspect when you have a need for service. So if someone encounters that barrier, we can also find funding for people. We actually just got awarded some grants, so we can supply people with the money to go see a trauma therapist that they wouldn't otherwise be able to afford. So we really are all about knocking down barriers and working with all those services in our community to make sure people get the help they need.
And talking about allies, I mean, you guys are allies as well. You are people that are non-judgmental, that will not have any kind of you won't be judgmental to how people are feeling, right? And I think it's interesting because when you go to the doctor or anything like that, you always feel a bit nervous about telling them what's wrong, right? I mean, it's a stranger essentially, and you just don't feel comfortable sometimes maybe telling them some more of the personal things that are wrong with you. But I know from a fact of you, Jody, and the people that work with MiND-AID that people, when they start talking to you, they'll definitely feel more comfortable expressing how they're feeling. And I think it's just taking that first step of reaching out to you.
Yeah, and thank you for pointing that out. And we are different than a clinic. I mean, this is my office. Quite literally, we're mobile. So we'll meet people where they want to meet. I've met people in parks. I've splashed in puddles with young people. We will come to the person in whatever way they want. So it might be that I'm working with a client only over text. It's hard to find a professional service that will just text with you if that's what you're comfortable with, but we'll do video chats, in-person, email, whatever the person wants. And I think that's the comfort piece. And certainly, no judgment. We're not here to judge, we're here to help. That simple.